An allogeneic bone marrow transplant doesn't happen without a donor. To recognize National Bone Marrow Awareness Month, we hope you can join the National Bone Marrow Transplant link for our November Lunch and Learn, featuring donor Reagan Bell. She'll share her incredible story and explain how you can get involved. Join us November 20th at noon Eastern. To register, visit nbmtlink.org or follow the link in our show notes. Welcome to Marrow Masters Season 15, sponsored by Kite, a Gilead company, and Bristol Myers Squibb. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplant, from diagnosis through survivorship. Season 15 of our show focuses on CAR T cellular therapy. This innovative and life-saving treatment is gaining momentum and has become a first-line course of treatment in recent years. We will dig in, learning more from clinicians, survivors, a caregiver, a nurse, and a psychologist. This season will offer education, insight, hope, and so much more. Here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. Today we have with us Lori Deer. Love your name, by the way.
Thanks.
From Corewell Health in Grand Rapids, Michigan. Lori is an RN and transplant coordinator in the Adult Blood and Marrow Transplant Program. She's going to share with us today the many details regarding CAR T and what the patient experience really looks like up close and personal. Welcome, Lori.
Thank you so much for having me. I'm excited to be here.
Well, we're excited to hear from you on this. So, Lori, let's talk about the role of the interdisciplinary team regarding CAR T for both the patient and the staff.
Okay, so I just want to start off by saying that there is no cookie cutter patient in CAR T or in transplant. You know, we talk about having standards and having the most common things, but truly every patient is so unique. And so that's part of why having an interdisciplinary team working for you is so important. There are so many different fields of practice, all focused on the common outcome of having a successful CAR T experience for a patient. And that starts with physicians, advanced practice providers, nurses, both inpatient and outpatient, pharmacy, physical therapy, infectious disease, cardio-oncology, and then there's the coordinators, the clinical care coordinators, which is what I do. But we all come together, we all practice at the height of our scope in order to fully cover a patient. And so I always kind of start with that for my patients so that they know that each of us are bringing our whole selves really to this experience to make sure that they're getting exactly what they need when they need it.
So, Lori, this is great. Let's talk about when someone is preparing for CAR T. What are the biggest things that they should know?
That's so great. There's so many things to know, right? So many things. But I kind of narrowed it down to a few. I think one of the biggest things is to do as much research as possible going into that initial CAR T consult, and maybe even kind of start to do some planning in your mind. Because the more planning that you can do ahead of time, the less caught off guard you might be in that actual appointment.
Okay.
And you'll kind of see what I'm talking about in a minute. Before you have that first appointment with your CAR T team, one thing to really think about is about a potential caregiver. Caregiver is a huge part of the CAR T experience. If you can start thinking about who might be a person that you would trust to be a caregiver, a lot of times people will choose a spouse or a friend. It needs to be somebody that you can trust and that you're willing to allow to help you.
Mm-hmm.
It needs to be somebody that can be available for an extended period of time, 24 hours a day, for a number of weeks, potentially.
Okay.
They're going to need to take part in education and appointments. And then as you're thinking about that, if you can start to kind of identify some people who could be caregivers for you and maybe even mention it to them. You know, I'm going for this consult. I might be needing some treatment that would require me to have a caregiver. So I might be calling you.
For most people, Lori, it's usually their spouse or their parent, I would imagine.
Right. And I don't always like to make that assumption just because there are so many different dynamics that can come into play.
Very true.
A spouse that can't take time off of work, for example,
Mm-hmm.
or a parent that is not geographically close.
Sure.
And so sometimes we have to get creative as far as a neighbor or a really good friend, or that's where the trust part kind of comes in, to think about someone that you would trust to be there with you.
Yeah, that is something to really think about. It makes me go to the helpers of the caregiver too. I would imagine just to give that person a break once in a while, it's important to have the B team, maybe.
Right. Mm-hmm. Yeah, we always say it takes a village to get a patient from beginning to the other side of CAR-T. This is very true.
Let me ask you this, compared to someone that needs an allogeneic transplant or an auto, are the caregiver responsibilities much different?
That's such a good question. I would say they're slightly different. I would say with an allogeneic transplant, a caregiver may be needed for a very extended period of time. It may be months, it may be years that they end up being a caregiver. And the things that they may be expected to do may be more long-term as well. For our purposes for CAR-T, we really rely heavily on a caregiver for those first 8 to 12 weeks after the infusion. And it's very specific, the things that we're asking the caregiver to help us with.
Okay.
Especially, we're looking for things like side effects after the infusion that they may help us pick up quickly.
Okay. We'll get to some more of that later. Let's jump in about eligibility testing.
Okay. There are a lot of things that the team will take into account when we're trying to figure out if this is a good option for a patient. We're going to look at things like performance status, which is how much of your daily activities can you do independently. We also look at organ function, specifically the heart, but we also look at lungs and kidneys and liver and every body system. We look for any current infections because that can kind of cause some competition with the CAR-T cells. There probably will be an MRI of the brain, and that's to rule out any involvement of the disease in the brain, but also to have a baseline exam going into CAR-T. And then disease burden or the disease status. So whatever we're treating, we want to have a good picture going into CAR-T of where we're starting.
Okay.
So when you go to meet with the team, you want to really be prepared for referrals and consults with specialists to kind of weigh in and help us make sure that we're doing everything we can to make this an optimal experience for you.
Oh, this is great stuff. Thank you so much for sharing this. So let's talk about housing. How far away can someone be from the center? I'm understanding that more and more CAR-T are outpatient now. Can you address all of that?
Sure. A lot of that is going to vary from center to center, the specific time frame and distance that they're okay with. But by and large, within an hour to 2 hours is kind of the standard. And like I said, that'll be specific to the center that the person goes to. Regardless of like the specifics, they will want you to be close. They'll want you to be not 5 hours away, especially for those first 8 weeks.
Sure.
So if you live far from a center that's, more than a couple of hours away, you might want to think about options for where you could stay. Think about if the center has any options available right there on campus. See if there's any housing assistance available. They may have some agreements with outside hotels or lodging facilities. There also may be some assistance available from the drug manufacturers or the CAR-T companies themselves. Most of them have some sort of assistance process where they can help with travel arrangements and lodging, sometimes even meals and caregivers.
Great ideas. So let's go over some of the things to think about during the treatment and then immediately post CAR-T.
Things to think about or to be prepared for really is something called cytokine release syndrome. And I'm sure that the other people in your other podcasts are talking about these things too. But it's really helpful to kind of have an idea of what might happen going into the admission or into the infusion process so that it hopefully will be a little bit less scary if it does happen.
Yes, Lori. In fact, we have had other podcasters talk about that syndrome as well.
Excellent. So just being aware of the potential for CRS, There's also ICANS, which is the neurological toxicity that can happen, and being really familiar with what those signs can be, what those symptoms can be, and what they can do to help with that. Being aware that your blood counts may be low at some point, and you may need some transfusions during the time right around the infusion. The other thing is knowing that if something does come up, if you do develop CRS, if you do develop ICANS, if they are concerned about infection, things are going to happen really quickly. There's going to be a flurry of activity, and people are going to be coming, drawing labs, getting an X-ray, wanting you to give a urine sample. And it can be kind of a flurry of activity. And it's just important to remember that all of those people that are coming and going from your room or from your bay, they're all focused on figuring out what's going on and treating it as quickly as possible.
Oh, that's good to know. What are some other things that you need to consider?
There may be specialists that are pulled in during the process.
Okay.
For lots of different reasons. They may, for example, send you to cardiology or bring in pulmonology or, ask a kidney doctor to weigh in on something. And so as you're going through the process, those specialists may be called on to kind of join the team and weigh in as far as what they would recommend, again, to make this an optimal and straightforward experience for you.
Great. And what about the fear of secondary cancers? What do you have to say about that, Lori?
So there is some research coming out now showing that there is an increased risk for secondary cancers after having CAR T. Part of that might be because of the lymphodepleting chemotherapy that are provided. They're still trying to figure all of those things out. So we really encourage our patients to be very diligent about any screening that their oncologist recommends, that their primary care doctor recommends. It's super important, especially skin cancer screening, mammography for women.
Colonoscopy, maybe?
Yeah, colonoscopies. And also oral care is super important because there is an increased risk for head and neck cancer after receiving treatment.
Okay, good to know. So, Lori, let's touch base on financial toxicity. It's something we all know. It's the elephant in the room sometimes. In fact, we wrote a finance book recently to address these issues that are particular to bone marrow stem cell CAR T transplant. How do you and your team handle this?
So I saw the book and it looks amazing. I think it's going to be hugely helpful for our patients. One of the things that we do is to have all of our patients meet with a financial coordinator. And this is someone who their job is to look at everything from the financial perspective. This goes back to that interdisciplinary approach. So we really look to them to look at everything from a financial perspective, from what the insurance company will cover, what they might not cover. If we need to apply for additional assistance from different organizations like Leukemia Lymphoma Society or BMT InfoNet. There are also assistance programs available through individual CAR T programs where there may be some assistance there. And really just connecting with that financial coordinator to troubleshoot ahead of time so that there aren't any surprises. The last thing we want is for a patient to get a bill for a very large amount and, be completely shocked by it.
Sure.
So if there's anything that we need to do, we'll even go to the insurance company sometimes to appeal if they deny coverage. And, you really want your team to be able to get creative if they need to, meaning, are they willing to go up the chain in order to help you be covered?
Oh, that is great, Lori. Thank you for that. So we are going to cover emotional and psychological recovery and the process and how to get through that. What are some of the most frequently asked questions regarding that you guys hear?
I think one of the biggest things is just realizing that it's normal to feel overwhelmed, to realize that it's okay if you're exhausted at this point. A lot of normalization. Sometimes patients are surprised to realize that they're not the first person that's gone through this and that they're not the only person who's felt the way they're feeling. Sometimes that's kind of refreshing for them to know, especially when we come up with, roadblocks. an insurance company that's being difficult, or there's this fear that like, this is the first time this team has seen this and I don't know what they're going to do. So a lot of reassurance that, this is not the first time we've seen a denial. We're going to fight this. We're going to appeal it. We're going to do whatever we need to do to make sure you get what you need.
Wow, that support is so important. I know you have a fabulous social worker as well. And the social workers are really such heroes throughout all of this, aren't they?
They really are. They're such a huge part of every aspect of this journey.
Yeah. I don't know what we do without them.
Mm-hmm.
We're going to jump back in a little bit more about the caregiver. We covered a lot. Is there anything else, tips or tricks or anything you recommend?
I think it's really important for a caregiver to know and understand the vital part they are to the team. They're not just a body to fill a seat. They're truly the connection sometimes between the patient and the team, because they're going to be helping us identify that CRS or the ICANS. Sometimes they can pick up on changes that are so slight that even a nurse who's taking care of that patient every day for the last 6 weeks don't pick up on.
Mm-hmm.
They may notice those first little twinges of something and be able to report that and allow that patient to get treatment much sooner than if we waited for the nurse to realize something was going on. It's great to have another set of ears in the room, especially if there's ICANS in the works. The patient may not be as coherent or able to express themselves the way that they would like to. So to have another set of ears there to hear what's being said and also to articulate it later to the patient is incredibly helpful. That communication of any changes to the team is critical for a caregiver. We're going to look to a caregiver to help with transportation, any meal prep that might need to happen, help with infection prevention. And the other thing with caregivers is it's important to engage them as staff, for us to engage the caregivers and build that rapport early on to help them realize what a huge impact they're going to have on this patient's course and be able to be that bridge between the team and the patient when they need to be.
Lori, I love how you explain that the importance of that relationship with the team, the caregiver, being honest and feeling safe with the staff. That is really so important, any transplant or therapy. So thank you for highlighting that. So we talked a bit about some of the side effects. I understand that with CAR T, the fevers, the infection can come on fast. And people, especially the caregiver, obviously need to be very proactive. And I think you kind of covered this. Is anything more you'd want to add about just that gut feeling maybe when something just doesn't seem right?
Yeah. So there's always those things that you need to do, like wash your hands and make sure you're taking your preventative medications and wearing a mask when you need to. But I always tell my patients, when in doubt, just call.
Mm-hmm.
If you're not sure, just give us a call. We're here to help you. And sometimes the only symptom you're going to show is a fever. So that's a night or day, 3:00 in the morning, that's a phone call. And that's really the big, red light that's flashing, is just that infection detection, really. And then just making sure to call us, take your prophylactic medications. Those are the things that will help prevent infections. And just knowing that when you do present with symptoms or you feel a little bit off, your team is going to investigate it and they're going to treat it like an infection until they know otherwise, because we know how important it is to treat an infection incredibly quickly.
Very good. In one of our other episodes too, someone shared that just having that phone number handy, the number to call day or night. And I think you can't stress that enough. And how welcoming you all are, the centers, just to having that open communication. It's really impressive. Thank you for what you do for patients.
Oh, you're welcome.
So as we wrap things up, Lori, I always ask this. It's so fun. Do you have maybe a story, an anonymous story of a survivor, inspiration as we wrap up our episode with you today?
Sure. So it was a Friday night. And I was just about to leave for the day, for the weekend. The phones were off and my phone rang. And normally if my phone rings after hours, it's from somebody that has my direct line. So I answered it, and it was a patient that I had coordinated a transplant for before. He was so distraught because he'd just seen the results of his PET scan and hadn't had a chance to review it with his oncologist yet, but he knew that from the wording that things did not look good. And he was so upset. He said, "Lori, is there even any hope? I've already had all of this treatment. I've already had a transplant. And is there anything that we can do?" He said, "I have grandkids and I really want to be around for as many Christmases as I can. Mm-hmm. And I'm willing to do whatever it takes." And so I just let him talk for that time. And when he was done, I said, "Have you heard anything about CAR T treatment ever?" And he had heard about it kind of in passing. So we talked about what that looked like. And I just encouraged him to talk with his oncologist about it the following week when he went to discuss the PET scan results in detail. And so sure enough, the next week I got a call and he said, "Let's do this. I'm ready. Whatever we need to do, I want to do it."
Great.
So he underwent the CAR T, did develop some of those side effects that we talked about, the CRS and the ICANS. He ended up needing an extra immunoglobulin infusion to help with boosting immunity after the CAR T process. But I am so happy to say that here we are 3 years later, and he's celebrated 3 additional Christmases with his grandkids. So,
well, isn't that great? Mm-hmm. We need these stories, right? They just make it all worth it. Mm-hmm. Well, thank you, Lori. This has been awesome. You are definitely the boots on the ground in the trenches with all of this, and we appreciate your insight today.
Thank you for this opportunity. I really appreciate it.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.